Hello class. So this video is going to be about mixing two insulin, and this makes sense to you because you're working in the diabetes content module. And so this video is strictly skill based. You should have a very solid understanding of diabetes at this point. That includes the pathophysiology, the complications, the nursing interventions, and things like that. Additionally, you should have a very solid understanding of the different types of insulin and the pharmacokinetics, meaning the peaks, the onset, the duration, and anything that you would need to know about it as far as nursing considerations go. So this video in particular is strictly skill-based. We won't be reviewing any of the critical thinking that's involved, but hopefully your brain is already starting to kind of think about those things. For today, our patient has a blood glucose level of 154, and that is about 7:00, 7:50, we'll say, in the morning, and tray delivery is going to be at 8:15. Now, your patient is a diabetic patient on a diabetic diet and will be eating 100% of their meal. This all makes sense to you, right? Because you have a firm understanding of diabetes. So looking at this particular medication administration record, I want you to, in a second here, pause this video and tell me what it is insulin, what types of insulin the patient will be getting and how much. Okay, so go ahead and pause the video. Hopefully, after looking at this medication administration record, what you need to have come to the conclusion of is that this patient needs NPH 12 units subcutaneously half an hour before breakfast in the morning, and will also need insulin regular 2 units because our glucose is 150 to 102, 150 to 200. We're 154, right? So on unit, you're going to find your insulin. You are going to perform hand hygiene, and then you're also going to don gloves because you're working with medications. Okay, there are two different types of insulin that we need here: NPH, which you know is cloudy, and a regular insulin, which is clear. And when you're mixing insulins, you draw the insulin clear before cloudy, which means you inject the air cloudy before clear, okay? And it gets a little confusing, but if you understand and after watching it, it will make a little bit more sense. So this particular nurse, and you're going to see this video, it recommends that you do 3 readings of the label. Insulin itself is a high-risk medication, and so it actually requires two nurse checks, meaning one, you and I as student and nurse, and then also a secondary nurse will need to come and check each insulin that is being administered to the patient. Okay, so you're going to see this particular nurse is checking the medication, the NPH, to the EMAR. Also, she is rolling the medication. NPH is cloudy. All the particles will fall down to the bottom. And so in order to get the particles suspended where they're usable in the suspension, she rolls it. If she were to shake it, it would actually create microbubbles, and then the dosing of the insulin would be incorrect. She's also checking the regular insulin to make sure she has the correct insulin with the correct EMAR. Gathering supplies, she needs alcohol, a syringe, and the 2 insulins. And what you're going to see here, she removes the caps from both, and then she uses 1 alcohol swab in order to clean both vials. My practice is 1 alcohol swab per vial. So I would take 1 alcohol swab. I'm going to clean the top of the vial there in a circular motion and leave that alcohol swab there. Using a second, my practice would be to use a second alcohol swab for the second vial and leave it there. She's also, you're seeing her here, inspect her syringe. Very, very important. Insulin syringes come in different sizes, different measurements, and 1 unit of insulin is not the same as 1 ml. Very, very important thing to keep in mind. So she's inspected her syringe, and then remember, we draw the insulin clear before cloudy. So we need 12 units of air to inject into the cloudy insulin. So she has pulled back 12 units of air into her syringe. She's going to, using a firm surface, insert her syringe into the vial, and then she's going to inject, you'll see her here in a second, the air into the NPH vial. the bevel of the needle or the tip of the needle cannot touch the NPH insulin. Very, very important to keep in mind because you are going to then put that vial into the other insulin and you don't want to mix the two. So there she's injected the 12 units of air into the NPH vial. Now she needs 2 units of air to put into the regular vial. She's going to inject that 2 units of air, and then she's going to invert both the vial and the syringe at the same time. She's using that wonderful claw method to keep it nice and stable here. And then she's pulling out 2 units of regular insulin. Okay, now if she were to happen to pull out to, let's say, 15 or 20, that's okay for this particular type of insulin, because she can just push the plunger back up to the 2 and not have caused any damage to what's in the current vial. But once she goes to the NPH vial, she cannot overdraw, or he cannot overdraw. Okay, so 2 units of regular insulin. Now we need 12 units of NPH, which means we need a total of how many? 14 is the correct answer. So she's going to pull that syringe to pull in 12 units of NPH insulin, which gives us a total of 14 units. Okay, and then she's going to withdraw the needle after she's done. And then she is going to recap using the scoop method in a very sterile way to keep that needle nice and clean. Okay, now at that point, she will go into her patient's room. She will use her checks, identifiers, and writes again. Yes, I said again, lots of checks, identifiers, and writes. Make sure she's in the right room with the right patient, giving the right amount of insulin. And then she will administer the insulin in the same way as a sub-Q would be administered for any other medication. The only thing that's important to keep in mind is that with insulin, a lot of students like to say, where would you like your insulin injected? And sometimes the patients say, oh, I'll take it in the back of the arm. That's a great teaching point, great teaching moment for you to tell your patient that actually insulin is best absorbed in the abdomen. Are you sure you would still like it in the arm? And they're going to say yes, or they're going to say no, the abdomen is fine. Either way, you've taught your patient something. Okay, please review this video several times. Be sure that you understand the steps of the video so that when we get into the skills lab and we have to do the do one portion of C1, do one, teach one, you are ready and rearing to go.